This video is intended only as an overview of the instructions and procedures required to operate the 3M Ranger Blood Fluid Warming System, Model 245, with the 3M Ranger Blood Fluid Warming Standard Flow Set 24250. This video is intended for clinicians. Prior to use, consult detailed product indications, limitations, safety information, and instructions contained in the instructions for use supplied with the product. The 3M Ranger Blood Fluid Warming System is intended to warm blood, blood products, and liquids. The components of the Blood Fluid Warming Standard Flow Set include an inlet line, blue inlet pinch clamp, fluid warming cassette, bubble trap, roller clamp, needleless injection port, lure connection, white outlet pinch clamps, and patient connector. To begin use of the blood fluid warming unit, adjust the warming unit height to the patient level or lower to help prevent the risk of air embolism. After securely mounting the warming unit, plug the power cord into a grounded outlet. Open the warming set pouch where indicated by the arrows. To reduce the risk of leaking and loss of therapy, ensure that all lure connections are securely tightened prior to priming. Before priming, slide the fluid warming cassette into the slot in the warming unit. Connect the short inlet line to the fluid source. Prime all tubing to purge air from the line. Invert the bubble trap while priming and fill. Place the bubble trap right side up into the holder on the warming unit and continue to prime the patient line. Close all clamps after the entire line is primed. Turn the warming unit on. On startup, the unit reaches its normal operating set point of 41 degrees Celsius in less than 2 minutes. The LED display located on the front of the unit displays the warming unit temperature. The temperature of warmed blood and fluids is verified with sensors that check heating plates 4 times per second. To reduce the risk of leaking and loss of therapy, do not exceed 300 millimeters of mercury pressure. Ensure inline hand pressure pumps or other pumps do not exceed 300 millimeters of mercury pressure. Do not remove warming set from warming unit while in use. Monitor fluid lines to ensure that they are air-free. The bubble trap does not eliminate air automatically. Close the clamp between the injection port and the patient connection. Invert the bubble trap. Insert a syringe in the injection port and aspirate air until the bubble trap and IV line are free of air. Place the bubble trap right side up in the holder. Open the clamp and continue the infusion. When you are ready to remove the disposable set from the warming unit, close the inlet clamp proximal to the fluid warming cassette. Open the outlet clamp distal to the cassette. Allow the fluid to flow into the patient for about 2 or 3 seconds and close the outlet clamp. Remove the fluid warming cassette from the warming unit and discard according to institutional protocol. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit our website. 3M offers device training upon request.